Welcome and thank you for joining us today. We will begin with Tiffany Lawrence Givens, the president of the University Staff Advisory Council. Tiffany? Tiffany, I believe you are on mute.
Sorry about that. Thank you, Kate. Good afternoon. Thank you for joining us for this fall town hall for Vanderbilt University staff members. My name is Tiffany Lawrence Givens, and I am the president of the University Staff Advisory Council. Today, I will be moderating this town hall, and I'm extremely excited to be here with you. I will start by introducing our panelists for the town hall. We have Eric Kopstein, Vice Chancellor for Administration, Pam Jones, Associate Vice Chancellor for Health and Wellness and co-leader of Vanderbilt University's Public Health Central Command Center, Cleo Rutger, Chief Human Resources Officer, and Kathleen Siebold, Executive Director, Vanderbilt Child and Family Center. During the Q&A session with each of our panelists, we will be discussing questions that were submitted in advance of the town hall. I would now like to welcome Vice Chancellor Kopstein to say a few words.
Yeah, well, thank you for that introduction, Tiffany. And first, let me also start by thanking everyone for being here today. And I want to express my deep appreciation and gratitude to all Vanderbilt staff for everything you do. You are a huge part of the reason our institutional response to COVID has been so successful. And I want to acknowledge your commitment and dedication and the extraordinary, truly extraordinary quality of your work. So thank you. And with that said, I'll turn it back over to you, Tiffany, who I know you have some questions for myself and the rest of the panelists.
Yes, thank you, Vice Chancellor Kopstein. Let's get right into the discussion. As you've mentioned, these questions were submitted by our staff members. Our first question for you is, will you please talk to us about the decision to bring staff members back to campus with the current rising cases of the Delta variant?
Sure, Tiffany, thank you for the question. So on the decision to allow really non-essential staff to come back to campus, let me remind everyone first that the university continuously monitors the ever-evolving COVID-19 pandemic and public health guidance to really do everything we can to keep our community as safe as possible. We began the current academic year really in a vastly better place than last year. And that's because over 96% of our population is fully vaccinated, which is incredible. That really is incredible. And it demonstrates a commitment by our staff and our community to our shared values and about the health of our community. So as you know, the vaccinations were really made possible in part through significant medical and scientific work done here at Vanderbilt University Medical Center. And vaccines remain the very best protection that our society has right now against this truly devastating virus. So based on our high vaccination rate, we were able to focus our efforts on ensuring our students have access to a world-class on-campus, in-person educational experience this fall. I also want to acknowledge, Tiffany, there are significant portions of our staff who've worked on campus throughout the course of the pandemic, and they really continue to do so given their specific roles. Each of our areas across the university has different needs. So there may be some staff who have remote work arrangements. Others will have hybrid work arrangements, while others will need to continue to be on campus given their specific role. So we're going to continue to take appropriate precautions related to the Delta variant, and I feel very good about where we are right now in terms of remote, hybrid, and on-campus work.
Excellent. Thank you for that, Eric. What are the protocols and compliance policies for staff members related to COVID-19 and returning to work?
Well, thanks for that question too. So first, and I think this is important, any individual coming to campus or engaging in campus activities, you really should monitor your symptoms before coming to campus. If you have any symptoms, you should get a COVID test as soon as possible. Like really, this is very important. And if you have symptoms, like I said, get tested. And staff can contact occupational health if they have any questions or need guidance or locations for symptomatic testing. Also, masking is required indoors on campus with the following exceptions. So vaccinated individuals on campus are not required to wear a mask in private offices, labs, or shared workspaces where individuals can maintain a distance between each other of at least 6 feet. And so in addition, masks have to be worn in a variety of other circumstances. So they're required indoors whenever minors are present. They're required at all indoor, off-campus Vanderbilt hosted events. Masks really must be worn in what we refer to sometimes as transitional community spaces. So think hallways, elevators, and all visitors to our campus are required to wear masks at all times. So also, a few more things on protocols, Tiffany. If an individual tests positive outside of the Vanderbilt testing program, they really need to report that positive test result to the command center. So our contact tracing can be initiated, and the tracers, who are experts, they'll provide appropriate isolation and other instructions for those positive individuals. And similarly, if individuals are identified as a close contact by any source outside of the Vanderbilt Command Center, they should report their close contact status to the command center as well, so we can take, for appropriate instructions and guidance. And then some individuals coming to campus may have additional requirements depending on their specific situation. For example, if an individual has an accommodation. So again, we think of our protocols as layers of protection, where one key layer is vaccination, another layer is masking, another is physical distancing, and another is really the critical central role of personal responsibility. So it's been great to see that our community overall is still really compliant with protocols and has been really cooperative with our health measures. And then finally, beyond all the things I just touched on, Tiffany, I urge everyone on this call to review our health and protocols website. There are a bunch of additional protocols outlined there that touch on a range of other specific topics like travel, gatherings, dining, various office scenarios, and more. And as always, any changes to these protocols are going to be shared with the community through that website and in our COVID-19 updates section of MyVU.
Thank you for that information. It's really good to have clarity about the different layers. And that leads us perfectly into our next question. Who do we contact if we see a VU community member who is not complying with the COVID policies, such as the wearing a mask indoor or not maintaining social distancing?
Tiffany, that is a great question. And this is a perfect opportunity to remind everyone that protocol compliance is both an individual responsibility and a team sport. So all of us have to do our part and take personal responsibility for our actions and ensure that we're complying with university guidelines to keep ourselves and our community safe. So first, we encourage, to your question, our community to step up and say something to any individual on campus you observe who isn't following protocols. I'll say, I think it's much easier to gently call someone out for protocol non-compliance in a community where compliance is already the norm. And oftentimes a gentle reminder is all that's needed. And however, if an individual that you notice continues not to follow protocols or becomes potentially argumentative with you, you have some more options. You can speak with your manager, you can speak with your human resources representative, and you can also contact the public health ambassador hotline for further follow-up.
Excellent. Thank you for providing those resources. What is the expectation for office-wide communication if a staff member tests positive?
Thank you. So to start with, Tiffany, individuals who test positive, those individuals are first notified by the contact tracing team when they learn about that positive result. So the contact tracer who's assigned to the case will interview the positive individual. They're going to do things like determine their infectious period. They'll provide isolation instructions to the individual, and they'll also identify any close contacts. And if there are any close contacts, the contact tracers will also follow up with those individuals. So managers and others are notified about positive cases really on a need to know basis. And one thing I really want to emphasize is that managers should not issue office-wide communications identifying positive individuals, and allow the capable command center, who you're going to hear from soon in the form of Pam Jones, let the command center handle notifications. If you need to know, you will know.
Excellent, thank you. Is there potential for us, the non-essential employees, to return to fully remote work based on COVID case numbers increasing on campus?
You know, Tiffany, great question. I honestly think it's very unlikely that we'll go to fully remote work. You did have the qualifier of non-essential staff, but there have been hundreds of essential staff on campus every day, supporting our mission and our students. And I just want to emphasize a couple of things that make me feel good about where we are. Public Health Central Command Center remains fully operational and leads all of our response efforts. And that team really is a national model for excellence. And even when cases are rising from a variant or otherwise, we've built now the muscles and the mechanisms to manage cases really efficiently and effectively. And I'll also add, our case counts right now are quite manageable, and they've been continuing to decline, knock on wood. We also continue to collaborate with our medical leaders at the Vanderbilt University Medical Center so we can understand our emerging data, and that our policies always reflect the most current scientific guidance that is available. So as I emphasized earlier, Tiffany, we're going to continue to monitor the evolving pandemic. We're going to adjust our protocols as needed to keep our community as safe as possible. And at least at this time, we're going to continue to move ahead and support our critically important mission here on campus of teaching, research, and education.
Excellent. Thank you so much, Vice Chancellor Kopstein. Now I want to turn it over to our next panelist. Pam Jones is Associate Vice Chancellor for Health and Wellness and co-leader of Vanderbilt University's Public Health Central Command Center. Pam will talk to us about the latest COVID-19 trends on campus and our testing and contact tracing protocols. Pam, over to you.
Thank you so much, Tiffany. And Eric and I had the opportunity to speak to your great group a few weeks ago, and I had a lot more uncertainty during that conversation than I have today. So that's good news. And an honor to be here today. One of the things I just want to ground us in is that, and Eric has mentioned much of this, but the guiding principles that we've used in the COVID response, and that is all the available medical guidance from CDC, ACHA, and VUM. Can you guys hear me okay? It says my internet is unstable. Can you hear me? Okay. We want to make Vanderbilt's campus as safe as possible while enabling our mission to continue as normally as possible. And keep in mind that because of our vaccination rate, we are probably the safest place you can be on our campus. Because if you look at the vaccination rates in the counties around us, they're much less than what you will encounter on our campus. So although it creates a lot of anxiety for people to think about coming out of your homes and back to campus, it's a lot safer to come here than go to the grocery store. I'll just put it that way. So keep that in mind as well. And then we've always tried to be flexible but not reactionary with what we do. And you've seen very measured approach over time. Next slide, please. Eric mentioned this, we have news. And what we are seeing on campus is we saw a spike around September, the week of September 4th. We fully anticipated that. And as you recall, some of the enhanced protocols that we put in place with indoor masking and an enhanced testing program, we did right before the spike because we knew it was coming based on what was going on around us and the activities of people coming back. So this was not unexpected. And we felt like we had all the right things in place to kind of control this. As you've seen, and these cases of 123 positives are all faculty, staff, students, everybody, the whole community. So although that may feel large, If you compare it to the case count in the city, it's actually pretty small. It's actually a pretty small number of cases. We know that vaccinated people are far less likely to test positive than unvaccinated people, and you can see those numbers here. The good news is the following week dropped to 83, and we're happy to report, won't be posted until the dashboard tomorrow, that we saw another drop this week, this past week. So we are headed in the right direction, even though the community around us is still in a spike. And they're starting to trend down a little bit, but it's still in a spike. So our Vanderbilt community has done a remarkable job of really controlling and maintaining this as much as possible. And as I've said to a lot of people, we all thought we'd be done with COVID, and everybody was ready to move along. And unfortunately, it was not done with us. And so we are still, hot and heavy on COVID. Next slide, please. I want to talk a little bit about our testing program because Eric's talked about layers of. Our testing program is another section that we have in place. We have a variety of testing that we're doing with our asymptomatic testing program. We are doing a random sampling, and this is the newest piece. And some of you might have gotten a little invitation email to go test randomly at our testing center. But this is a surveillance program, a sentinel testing program. And I recorded a brief thing about this last week that'll give you more details that you might want to take the time to go watch. But essentially what this does is gives us a snapshot without having to test the whole community again. Gives us a snapshot of, are we seeing increase or decrease in the positivity of our asymptomatic vaccinated individuals? So it gives us a little bit of a tool to know, are we headed in the right direction? And if we're not headed in the right direction, we have backup plans for additional precautions that we can put in place. When needed, we go in and do immediate hotspot testing. So this has never happened in a work area. It has happened in group settings with students, for example. And we go in and test a whole community because we start to see what we call a cluster or a hotspot. We're testing vaccinated asymptomatic close contacts. And as you know, the contact tracing, Eric did a great job. He can have a new job as a contact tracer if he needs to after this past year. But we go through and identify very carefully who are close contacts. And those individuals will get an email that tells them exactly what to do. CDC recommends testing 3 to 5 days post-exposure. And we're very carefully watching that. And soon we'll have enough data to be able to actually predict your likelihood of converting if you are a close contact. What we know so far from watching the data is that most likely people who convert are household contacts, so have a family member who is positive, or kind of what we think of as special contacts like couples, those kind of things. Those individuals we are not seeing yet, and we hope we won't, spread from what we think of as normal campus activities, classrooms, work settings, those types of things. So that's really good news as well. Even though we know Delta is highly contagious, that's also really good news. So for the small number in our community, and as Eric said, you guys are to be commended because nowhere in the country that I know of, there may be a few other college campuses that have this vaccination rate, but it's remarkable. But we know that we need to test, and the president has just made recommendations around this for all businesses with greater than 1,000 people. All unvaccinated individuals need to participate in weekly testing, asymptomatic testing. And then, of course, as Eric mentioned, it's all about symptoms. If you have symptoms, do not come to campus and go get tested. And testing is available through occupational health. And there's also a 7-day-a-week option now at 100 Oaks location. If you're not so sick that you need a physician or a nurse practitioner to examine you, and you just want to go get a test and you're symptomatic, you can go to 100 Oaks and get that test. Next slide, please. So what are our trends? Caseload appears to be stabilizing, and I say that with great caution because we know that could go either way. but it appears to be stabilizing. We continue to see spread in both vaccinated and unvaccinated individuals, but we know, remember, vaccination is very effective at protecting you against severe illness, hospitalization, and death. And if any of you have family members who are not vaccinated, please encourage them to do it, because literally people are dying who do not need to be dying because they could have been vaccinated. So that's my public health message that I say everywhere I go. So forgive me if that offends anybody. I know there's strong feelings about vaccination on people's part, but it is an important tool to prevent severe illness, hospitalization, and death from COVID. So we do know that the number of asymptomatic vaccinated individuals who are testing appears to be pretty low. If you recall, we worried a lot last year about the silent spreaders of COVID who didn't have symptoms. Delta is so contagious and makes you so sick that even vaccinated people are almost all having some symptoms. So again, it's about symptoms. Next slide, please. So we're in good hands. As Eric said, the Public Health Command Center remains in place. Andrea George is the partner of a lifetime for me in that. And the two of us watch this data, every case, every day. So, and Vanderbilt is to be commended for having put the resources in place to actually spend so much time worrying about the health and safety of all of our staff on this campus. So I think you should all feel good about the employer and a commitment to each of you. Ongoing situational awareness and decision-making makes us able to very quickly make changes. You've seen us do that. Sometimes the changes feel fast, but we felt like we had to do them because of the trends we were seeing. Full alignment with all the leadership, including the chancellor, the provost, everyone. We are all in this together. And then testing capabilities remain scalable if we need to. If we have to start testing more, we will. And for our students, isolation and quarantine housing contingencies are in place or underway. So I think that's all I have today. And I think you may have a few questions for me.
Thank you very much, Pam. It is really beneficial to learn about the many efforts that the campus is taking to keep us safe. So my follow-up questions are, what is Vanderbilt's plan if we experience a major outbreak or influx of new cases?
That's a great question, and I know everybody worries about that. And as Eric said, we have the muscle strength to flex up and down as needed. We have very capable people in place, expert clinicians, expert operational specialists to help us manage this. So we feel very good about where we are and our ability to just deal with it. Whatever comes our way, we will deal with it.
Excellent, thank you. Will Vanderbilt be able to provide staff members with the vaccine boosters? And then as a follow-up to that, how about the annual flu shot?
Okay, so boosters are is the question du jour, right? Nobody knows the answers because the FDA has made recommendations. It's most likely that the Pfizer booster will be the first that is approved. And we are anticipating the CDC may be doing that next week. It will likely be approved for over 65 years old and particular groups at risk. So Kathleen's staff, for example, who are in contact with children all the time, would be considered at risk. So what we will do is follow the guide of the FDA and the CDC. Moderna has submitted, and the vast majority, we're 77%, I think, Pfizer on our campus. The Moderna vaccine and Johnson & Johnson do not have approval or recommendations from the FDA yet. So again, we can't do boosters until the government decides what they want to do with boosters. When they do that, we're very confident through our relationship with the UMC that we will be able to get access to boosters when appropriate. The flu vaccine, this is going to be a really important flu year because remember last year, we didn't have a flu season because we were all away from each other, but we're back. And the flu, if you haven't had it in a while, is no fun either. It's not as dangerous as COVID, but it is no fun. So get a flu vaccine. They're not doing Flulapalooza, they're doing Flula-2-Uza again, and Cleo may speak to that later. But we're working with our partners in occupational health to get you access to that as well.
Thank you, Pam. Those are certainly extremely helpful updates. Next, let's welcome Cleo Rucker, Chief Human Resources Officer. Good afternoon, Cleo.
Good afternoon, Tiffany, and thank you, Eric, and thank you, Pam, and thank you all for joining us today. Look forward to answering some questions for you.
Excellent. Let's get started. What is the university doing to support staff members during this pandemic? And then as a follow-up, additionally, for those working remotely, how does one maintain work-life balance with the current remote work culture?
Again, thank you, Tiffany. And I want to take the second part of that question first, because I think it's really important. We understand and recognize that during these challenging times that we're all facing and all navigating, that work-life balance has become something that has been challenging for us all. And so one of the things that I want to make sure that we are all doing as whether we're leaders, but also just as employees, that we're also and always making sure that communications is happening. Communications is more important now than ever, and that's communications between staff members as well as their leaders. It's extremely key during this time. And what does that look like? Communicating about the expectations of the work and the scheduling as well as we're trying to maintain this work-life balance. But this is us as employees talking to our leaders about, our work hours, our availability, what communication systems we may use, what our meetings look like, really, discussing key projects, deadlines, responding to emails, and really getting to the point of establishing what are the boundaries that we're going to work under. That's really important, and as we have that expectation of what our work-life balance will be. Now, back to the initial part of that question. When you talk about what is the university doing to support staff during this pandemic, the university continues to build out and has built out different resources to help staff during the pandemic. We've created additional benefits in leave banks as well as the emergency relief funds. So for example, we talk about the COVID leave bank. This was the bank that was established to provide some time for employees who were required to, quarantine off campus and who could not perform their work, as well as to provide employees opportunity to isolate and recover from COVID itself. Of course, the university stepped out last year to establish the leave bank, but the great thing about it is that we as leadership, we've moved ahead to continue to offer the leave bank going into this to the second year of us dealing with the COVID challenges that we face. In addition to the COVID leave bank, we've also established the COVID vaccination leave, which also provided paid off time for employees to get the vaccination and to recover from the side effects of the vaccine. While right now we're at a pretty high level of, across campus, thankfully, of employees who have received the vaccination. If we get to the point of the boosters, we will look at how do we extend the vaccination leave to allow and provide employees the opportunity to get away as well. In addition to the leave bank and the vaccination leave, there were some resources that we've provided as an institution as an employee emergency relief fund, which provided employees some additional assistance for, whether it was some needs that they had for financial needs that they had for their families, or also some financial help as it relates to some childcare needs. And I'm excited that Kathleen will get on here shortly to discuss some additional support in that space. The Emergency Relief Fund provided some assistance and does continue to provide assistance for employees there. Also, we have done a lot of work and we've worked to provide employees as well as leaders resources in the remote work and hybrid space. And I would encourage you as staff members and leaders to look on the university's website and look at the remote and hybrid work toolkit, which provides resources for work-life integration and well-being, talks about logistics, technology, and equipment, as well as just some communication resources for employees as well. So when I think about some of the support and services that we've provided as an institution, those are some things that we've done. But since this is one of those areas that it's of course, new and constantly changing, we look to continue to offer support and services in this space, and also welcome any recommendations that the Vanderbilt community as a whole may have.
Excellent. Thank you, Cleo. What mental health and wellness resources are there for staff experiencing burnout or other mental health issues associated with changes that have been made due to COVID?
Thanks again. And that goes back to the communications part, the communications with our leaders. You know, each of us have some very unique situations and or situations and circumstances surrounding our work as well as our family lives. And I think we need to be really intentional about communicating, our needs to our leaders, but also discussing the work that we need to perform with our leaders as well, and to ensure that we are maintaining, communications and preventing the burnout that we need. Also, EAP is an amazing resource. We're constantly working with EAP to discuss what opportunities and options we have to provide services and support to our family of the Vanderbilt community as a whole. But also, they're able to bring resources to us and to see what, really examine what is working and what is not working. For example, one of the things that we're working with EAP on is, in addition to doing the kind of the Zoom sessions that we have, because we all know one of the biggest things that we are challenged with now is the Zoom burnout itself, is EAP is working to establish short recorded sessions that employees can view on their own and at any time, that really discusses mental health challenges and provides different options and resources, and even tools as it relates to how do we prevent the burnout that we have or that we may be facing, and how do we really move forward in adjusting our lives at this time. I do really want to mention the importance of all of us, really taking our time off. PTO is an amazing benefit that we have on campus, and I would really encourage us as colleagues across the university to encourage ourselves to use our PTO and to talk to our leaders about this paid time off, because I think our time away from the work and the time to rebuild and to re-energize is something that's really important for us to maintain our own mental health and to come back refreshed as we may need to.
Thank you for that information. Mental health is so important, especially during this time. So it's nice that we have those resources available. How do remote employees participate in and gain from the on-campus benefits that the university offers?
The great thing is now most of what we're providing is easily accessible remotely. When I talk about the remote hybrid toolkit, that is something that's accessible online and that anyone can just access there. Also, when I think about the services that EAP offers, we as a whole, as the university employees, have access to call and to have sessions that are sessions that don't necessarily need to be in person, but sessions that can be basically over the phone or via Zoom. So right now, there's really very little services that are offered and benefits that are in-person benefits that are not accessible online. And I will encourage, if there's something or some services that individuals see that they're having issues, assessing, please give us a call in HR and we can help you really navigate the services that are out there.
Excellent, thank you. All right, last question for you. If an employee has to quarantine as a result of a close contact with a positive family member, is the employee allowed to work remotely?
It really goes to the nature of the work and the need for the employee to be on campus to perform their work. I think early in the conversation, we talked about the essential versus non-essential roles that the different employees occupy. Yes, we know that the essential roles, it may be, basically impossible for an employee to work remotely if they're at home quarantining. However, if an employee can do some of their work remotely and they've had the conversation with their leader, I think it really becomes a discussion with their leader to allow them to perform that work remotely while they are quarantining. And I think if there's additional questions or concerns, I will encourage each employee to give, of course, first start with their leader. But if there's additional questions or concerns about these situations, please give your HR consultant a call and they can help you navigate this space.
Thank you so much for your time, Cleo. We appreciate all the efforts the university is taking to support us as staff members.
Thank you, Tiffany.
Our next panelist is Kathleen Siebold, Executive Director, Vanderbilt Child and Family Center. Kathleen, let's jump in with the first question for you. How is the university supporting staff members who have childcare needs?
Thank you for this opportunity, Tiffany, and to all of our audience for welcoming all of us today. The Child and Family Center operates with programs that support Vanderbilt employees across the spectrum of life. That starts with new parent journeys all the way to employees managing elder care journeys. I will get to your question. As far as supporting families specifically with childcare needs, we do continuously update our links on the family life page of our website, and we link this to VUHR, and we amplify it in other resource publications. We continuously update to community resources to support families, including families beyond the employees that choose the Acorn School as their childcare provision. And this includes, of course, highly amplifying any free resources that could be out there. We did a very big campaign over the summer to support parents to expect the Biden tax exemption for working parents, which benefits families that make less than $400,000 a year with a per child payment. Additionally, we amplified where there were resources, especially those connected to the Y and the Metro Public Schools that benefited beyond early childhood and into school-age childcare. So really trying to support parents to understand where these resources exist is a critical part. And we are constantly trying to update communication strategies so that parents will not have to work so very hard to look for them. But we do encourage parents to visit our pages, and we do seek to keep those updated. Additionally, we've tried to be responsive within our childcare provision, which many parents who access it or seek to access it know it as the Acorn School, which is a provision of licensed childcare that supports children ages 6 weeks through 5 years of age. We have been able to expand programming this year, and even under the threat of the Delta variant, by being working extremely closely with our public safety partners. And I have too much to say about Pam Jones and Andrea George to say it here, other than to say we are open for business because of the exceptional collaboration between these partnerships, and including within the Division of Administration. The plant ops ability to be swift with remediation when we have had a test positive case has allowed our parents to get back to work sometimes by the next morning, instead of originally it was a 3-day process of remediation. So our teams are just better at this now, and we are going to continue to get better at this. And then I think that there's grace in the collaboration. The families that we partner with understand that we are also, all of us that work at VCFC, employees of Vanderbilt University. The leadership team at VCFC is over 80% full-time working mother. So we are managing a resource that we benefit from. The staffing at VCFC is over 90% working woman. And we know that the pandemic has impacted all, but we know it has come down hardest on the working mother. So we are very mindful in the stress that families are experiencing by seeking to amplify the resources that we have, by creating access and further access, which is, joyful for us when we can come up with this. We had a moment after a really interesting year. We had a moment in April where we realized we had offered placement for fall to 100% of the wait list, people who had been on the wait list as of January 2021 or prior. And when I was hired in 2017, the wait list was over 400 children long. And today my wait list for 2021 placement, now not 2022, that's a different wait list. For 2021 placement, I have 8 children on my list. And I'm still hoping I get to call them in the next couple months. So it's just amazing what is possible when you have the right team in place. And I am surrounded by the most magnificent team, and I'm very grateful for it. I also want to say there's an issue of access, and VCFC has worked extremely hard to make childcare affordable to more people by expanding our scholarship program and trying to amplify the expansion of that program. Additionally, VCFC supported the State of Tennessee DHS, Department of Human Services, essential care worker payments. We processed over 1.2 million in direct payments to parents without hiring a single additional staff person. And let me tell you, that was not nothing. And I won't pretend it was my fingers that got dirty. I want to just big shout out to Linda Wilson and Elaine Gallagher for their countless hours getting these payments out and about, and supported by our Division of Administration financial team, Audrey Sanborn and Ben Morse and Nicole Doctor. Just incredible efforts to get this done for parents. We're very grateful for it, and we will continue to seek and understand where we can do more. We are currently managing almost 50 more children this semester than we were in the spring at the same staffing levels. We are proud of what we've been able to figure out how to do that. And of course, we always want to do more.
Thank you, Kathleen. It's amazing what you and your staff are doing to keep our children safe. So thank you for that. When will full operating hours be restored at Acorn School?
This is a staffing issue. And so I want to be transparent about what has required us to roll our hours back from 7 to 6 to 7:30 to 5:30. We have had to take 30 minutes off the front because we needed 30 minutes off the end, and we were seeking to gain that hour by privileging the hours that most families needed most. And we have extremely low usage from 7 to 7:30, and we have extreme difficulty staffing 5:30 to 6. And the staffing difficulty is because, again, we are a department that is highly comprised of working mothers, and they need to get their children between 5:30 and 6, which means they need to, including school age programs, end before 6 o'clock. So we have had to cut our coat to fit our cloth. We will be continuing to work very closely with our VUHR partners on staffing opportunities. And we will also be very happy to announce when hours can be restored to pre-pandemic hours. But we are also very happy that we were able to restore the hours we have been able to restore, which we're very grateful for.
Excellent. Thank you, Kathleen, for these updates. We're at the end of our time together today. My special thanks to everyone who submitted questions. A record is being kept of any questions we did not get to today so that they can be addressed on the Health and Safety Protocols website. Additionally, a recording of this town hall will be available on that same site, the Health and Safety Protocols website, if you'd like to view it later. If anyone was not able to attend, the link is in the chat. Thank you again to our panelists for being here. And to you, our audience, thank you for taking time out of your busy work schedule to attend today. That concludes the town hall, and I hope you have a great rest of your afternoon. Thank you.